We're close to being live on YouTube.
Okay. You are now because I can see the content of this meeting is being sent.
Oh, okay.
Hi.
Hello. Happy Valentine's Day, guys.
Happy Valentine's Day.
All right. And then we're live on Instagram now as well.
I'm just waiting for that to come up so I can.
Happy Valentine's Day. Oh, there's my sister. Hi, Jojo.
I don't see
Hello.
I don't see you coming up on this. Let me do
I might have
this.
to refresh it.
There we go. Okay.
All right. Hi, everyone. Happy Valentine's Day. Happy Valentine's Day. You all are so very loved. Thank you. Thank you for it's a shirt. It's a shirt. I tried to dress up for you guys today. Like I put on lipstick. I tried to curl my hair and it was such like I'm a 37-year-old that doesn't know how to use a curling iron. So this is what we ended up with, guys. All right. Last week we had to cut things short. So we are making up this week and we're gonna have a raffle for this here. This is the Handle with Care sweatshirt. I don't know if you can see it well, but it says Handle with Care. This way up, hydrate, keep warm, keep dry. And then it has contains strength, perseverance, self-reliance, all of that. And it has our logo, love and respect, sickle cell awareness. I like this shirt because I wear it when I'm not like, you know how like you don't sometimes you don't like telling people that you're sick or you don't like telling people you're like in some sort of, you know what? I don't even have Dr. Q here. I'm sorry, Dr. Q. I'm
There
adding
you
you
go.
now.
Now we go.
I was like, wait a minute, someone's missing here. Something's missing. Anyway, so this shirt here is for when you are not feeling well or when you're going to the ER or when you're going wherever, you signal to everybody, hey, handle with care, like I'm not feeling well, and people should know to handle you with care. So we're giving this away for Valentine's Day just to show you guys we love you so much. We'll also have a special guest. I begged my sister to come on live and ask a few questions with me today. So my little sister, her name is Johanna. She has sickle cell 2, type SS. We have like the same genotype and everything, but present completely differently. So she's a little bit shy, so be nice, guys. Okay. All right.
That looks like a good sweatshirt for the ED, actually.
Yes, it's good sweatshirt. Like, you don't have to side eye the nurses anymore. You just point to your shirt and say, so yeah. Well, and JoJo, my sister Johanna, JoJo, will be picking out who wins the sweatshirt. And yeah. So, um, feel free to go ahead and start putting in your questions in the chat below. And we will go ahead and get started. I see here a question or a comment here. It says, are y'all pushing the pharmaceutical industry on sickle cell folks? Because why we never talk about holistic medicine for sickle cell? So I'll say it like my little thing with this. We like to push everything that is good for sickle cell. There's not one method of treating sickle cell. Of course, you need to be eating healthy. Of course, you need to be getting your supplements and vitamins. course, you need to be drinking water. You need to live a healthy life. But also, in addition, you do have that genetic mutation um, that pharmaceutical or drug therapies are aiming to correct as well. So I don't ever like pitting pharma against natural. I think it's everything. It's mental health, it's healthy living, it's nutrition, it's the drug therapies if they work for you, right? And not everything works for everybody. I take turmeric. I take vitamin D because it's important. And so it's not that we don't talk about those things. It's just, we're our approach is to tackle all of this holistically. So it's not just if you're just doing pharmaceutical, you're doing it wrong with sickle cell. If you're just doing natural natural foods, maybe I don't know. There's some people who do pretty well on that. But it's like you have to do mental health, you have to do natural foods, you have to do all the components, all the spokes of the wheel in order to tackle sickle cell in the best way. Um, the other thing I'll say is a lot of stuff that we do or that we present to you is evidence-based, which means this has been tested. This has gone through a clinical trial, and it's a large population or a bigger population these therapies have been tested in. So therefore, we can I don't want to say confidently but we could say, hey, this typically works for most people. We never want to give you bad advice. And so therefore we rely on science that says, hey, this typically works for people. Of course, not everything is a one size fits all, but hey, this typically works for people living with sickle cell. Try this out. Unfortunately, um, when it comes to natural stuff, there aren't too many studies with the correlation between, some sort of supplement or a correlation between something and sickle cell. And so we wouldn't ever tell you, hey, so and so is great for sickle cell because there's no science behind it or because it hasn't been studied. We don't want you to end up sick or we don't want you to end up worse than you are. And so we err on the side of science so that we can provide this information. We do mention like studies that are going on. Like I said, turmeric, CoQ10, those have been studied in sickle cell. Marijuana has been studied in sickle cell. So those things we can confidently speak to you at with, and there's still more studies evolving around that, and so those things we will mention. But if it's like something that we've never heard of, and we're happy to look into it if there is a study, but if there's something we've never heard of, we're not going to just straight out tell you, hey, go take this berry for whatever, because even grapefruit can interact with your medication, and that's something that's natural. Grapefruit, if you're taking a medication, a lot of times they say don't take grapefruit with it, which is something that's natural because it counteracts something. So everything needs to be studied, everything needs to be tested. And so that's why we're always careful with the information that we present to you. If something works well for you, you're more than welcome to share it with people, and people can decide for themselves whether they want to try that or not. But we really, if there's something that a whole bunch of people say is working, then it deserves a study and it deserves peer review. We have all of our experts coming in, looking at the results and everything, and then determining, you know, if it is something collectively for individuals living with sickle cell. So that's what I'll say. I know that was a long rant. Dr. Q, do you have anything to say, or maybe am I wrong? What do you think?
Well, it depends on what you mean by holistic. I mean,
Mhm.
I don't think we focus primarily on pharmaceuticals, but it is a balance, and the pharmaceuticals don't work for everybody. So you have to have, um, you have to try things and see if they work for you. The problem with naturopathic or herbs and stuff like that is that you could spend a lot of money on something that turned out not to work so great for you, and you wouldn't have any there's no evidence that it would work, and then you find out it doesn't work. And there are a lot of scams of people selling things to people with sickle cell disease that definitely don't work. But a plant-based diet, exercise, rest, lots of hydration, those are like the baseline things that you should be doing if you have sickle cell. And diet is really, really important. There was a study that we talked about a long time ago, where looking at people who had sickle cell who didn't have a good diet, who were underweight, people who had a good diet and took better care of their health, and it was dramatic in terms of the outcomes. So um, diet is really important. Don't think that vitamins and diets and vitamin D, especially now, it's winter, so you're not out in the sun, and so you need vitamin D. It's really important for your health. So taking vitamin D is not a bad thing to think about, as well as other vitamins. And since we're talking about vitamins, like L-glutamine is you could almost it's not really a pharmaceutical medication. It's an amino acid that's been purified and been shown that it actually decreases pain and some complications of sickle cell disease. So if you didn't want to take, a pharmaceutical, then L-glutamine would be something that you'd have to think about. It's hard to take because you got to take a lot of it. You got to take it a couple times a day, but it actually does work. So it's just something to think about.
Okay, hopefully that answers your question. I don't want you to think that, we're against, um, natural foods or whole foods or anything like that. Like we're 100% for that, and I think with sickle cell, bad food can exacerbate and unhealthy living can exacerbate sickle cell. And Dr. Q talked about that study in Saudi Arabia where it does say nutrition is extremely important within sickle cell. So you're giving yourself the best shot when you're eating healthy exercise. They've done studies on exercise and showed that it could, reduce pain and change mood. They've done studies, all of that stuff. Um, we talk about a lot, and you'll see some of that stuff on our page as well. So it's not just pharmaceutical, it's just like it's everything sickle cell related, and we want to make sure that we're covering all of that. And we want to make sure we're covering all of that in a way that we're not misleading you or giving you incorrect information. So that's what it is at the end of the day. Um,
It's also hard to recommend things where there's no studies. You really have to go on some kind of evidence base, not just three people took it and it seemed to work for them. You need to really get a little deeper than that.
all right. I'm gonna bring my sister. Let's see if she comes on and have her say hi to you. And then while we're doing that, I love this question. Why do some warriors look chubby and others look skinny?
Hi.
This is my little sister Johanna or JoJo. She has sickle cell too, type SS. And I invited her today because I realized I don't know. Is this your first time on the live after all these years?
I think so.
So, y'all, I have another sister with sickle cell. And you know, it's nice because we get each other. We just that look, and we already know. Like we have some sort of what is it? Telepathy. I don't know how to say that word. So she's gonna help answer some of your questions. And Jojo, do you want to go ahead and start with, I guess, the first giveaway for our handle with care before we get into why do some warriors look chubby and skinny? Sure. I guess let's do the first person who does
three pink hearts
In the chat?
in the chat. Yes.
Okay. I gotta keep my eyes peeled. And this is here the sweatshirt handle with care.
Yes, I love my sweatshirt. It's very
It's
comfortable and
yeah,
soft.
it's very
Yes.
comfy, very warm. Oh, I see it. I see
Uh,
somebody. I see someone.
it looks like crystal.
Crystal. Hold on, let me write this down. Crystal 36
Thomas.
Thomas. Okay, Crystal 36. We're gonna follow up with you. Congratulations. Hope you like the
Yay!
sweatshirt. All right.
Happy Valentine's Day.
Happy Valentine's Day. All right, Dr. Q, why are some people chubby and why do some people look really skinny? And I will just say I was the stick in my family. Like I was really, really skinny. My siblings used to call me toothpick. Not JoJo. She was a nice one. So yes,
I
why do some of us look skinny? Why does some of us
I mean, I don't think it's any different than anybody else. I don't know that sickle cell disease as a child, you do use up a lot of calories making your bone marrow is really hyperactive because you have to make blood constantly when you have sickle cell disease. Your red cells only last a couple of weeks, and so you spend a lot of energy making red cells and um, it just uses up a lot of calories. So, but besides that, as you get, I don't, I'm not sure that it makes any difference. There's I think there's genetics involved in it. Some people genetically are just bigger than other people, and I think it depends on some people just like to eat more than other people, and they if you don't if you it's it's like the new drugs they have for overweight people. They work on your central on your brain, so there is something about that we'll learn more about in the future, but I don't think there's anything about sickle cell disease that is different than other people when it comes to weight or anything like that. Except in as a child, you may be a very skinny little kid because you're not eating enough. Your mom's not sitting there with the spoon shoving the food in your mouth.
And Dr. Q, you've mentioned that people with sickle cell need a high caloric
They
diet,
do. They
um,
do.
because you need that energy. Because think about the way I understand it, and correct me if I'm wrong, Dr. Q, the, your all the energy your body is producing is going towards making more cells instead of going towards like you gaining weight or going towards other things that require energy within your body. And so maybe that's the reason why some of us are like skinnier.
I think historically it's also, you know, decades ago when before I was doing this before hydroxyurea and other medications, and I think as things advance, hydroxyurea, your hemoglobin goes higher. So you don't you're not your that affects your appetite. More people are on chronic transfusions, so you don't it suppresses your bone marrow. So I think as therapy changes, this idea that you need a lot of calories, you do as a overall for sickle cell, but I think because the therapies that people use change the presentation or the way sickle cell works in your body, that also has an effect on your overall energy balance. Um, so as new therapies come along and people are more well, uh, the calorie thing kind of fades out.
All right.
Like from my experience, I was then I think after starting blood vision, it made me like not so skinny anymore.
What did you say? You're not
I don't
so,
know.
you're what?
Maybe the hormone blood.
Hormones? Oh, I couldn't hear you, Jojo. Could you hear Dr. Q?
No,
I said like after getting blood transfusions.
Oh, you asked after blood transfusions?
Yeah, after blood transfusions, I think because of the hormones in the blood made
Hormones
me
from the
gain
blood.
weight, I guess, or some of the blood transfusions made me gain weight. Because I after starting blood transfusions, it kind of made me gain weight. I don't know if that correlates.
Is there a correlation there, Dr. Q?
well, blood transfusions, like I was saying, then your bone marrow is suppressed to some degree, and you don't need the calories that you would if you were not on blood transfusions. Um, so that's the only thing I can think of that's different about being on chronic blood transfusions.
All right. Did you want to ask the next question?
Sure. Let's see. Are you going in order, Cass?
No, just I choose any question and I'm typing all the questions down.
Okay.
Just choose any question you see there.
It says, so my 5-year-old has SS and he's on hydroxyurea, and I'm looking to transition away from that. I came across an article about papaya leaf extract as a holistic substitute. Anyone try this?
Well, I didn't get what the extract was, whatever that is.
It
It was
says,
papaya.
I came across an article about papaya leaf extract as a
Oh,
holistic substitute. Anyone
oh.
tried this?
Yeah, I don't know anything about papaya leaf extract. And again, like we were talking about before, is that if there's not some kind of a study looking at not a few people, but a lot of people and comparing that to, people say doing that, comparing it to hydroxyurea, then I think you're in kind of a territory where you're not sure if it's going to work. There are, I think if somebody, I'm not sure why you wouldn't want to take hydroxyurea, except that it's a
I was gonna
pharmaceutical.
say, yeah, what was the reason that you wanted to take
Yeah, I mean, if you just want to get away from pharmaceuticals and medication like that, you just have to realize that particularly hydroxyurea that's been used for like 30 years since the 80s probably, um, and it's well tolerated by most people. It doesn't work for everybody, that's definitely for sure, but it definitely is one of the medications that has been used for a long time and has helped a lot of people with sickle cell disease. So I think you need to, if you're going to do something like that, you should talk to your sickle cell provider and find out what they think about it. And maybe they could look into that supplement to see whether there's any validity to it. Um, but it's a big deal to go off of your one medication and go on to an untried and tested medication or naturopathic thing.
Yeah. And it all depends on why you don't. And I would say any reason is valid, right? Like as long as you have the information at the end of the day, that's
Yeah.
really what matters. It's not that we're pushing one way over another. It's just you have all the information. A lot of times people don't
Right.
have all the information. Um, but you'll hear a lot of physicians go hard on hydroxyurea because it is literally the only medication that has been studied as long as it has specifically within sickle cell. That's why you'll hear doctors always mention hydroxyurea, hydroxyurea, hydroxyurea because it is the longest studied one. Um, right now, as of right now, only hydroxy, and I think there's what 30 years worth of research behind
Yeah.
hydroxy. So it's the longest studied drug within sickle cell. And they've seen like, minimal um adverse effects. We have seen people like it work for people and then it stopped working, or people just not tolerating it. But it is the longest studied drug within sickle cell, so that's kind of the why you always hear about hydroxyurea. There are newer therapies there, but they don't have the length of research, or they don't they're new. So, they don't have decades backing them, decades of research backing them. Same with the gene therapies. They don't have decades of research backing them specifically within sickle cell disease. And so, I think physicians call hydroxyurea standard of care at this point. And, it's kind of like the default therapy, if that makes sense. All right. I see one here. Can you talk about, as siblings, what are your own experiences? How many crises you have or don't? My kids both have sickle cell SS, same as you, and my daughter gets sicker than my son. What is your own experience? Before me and Jojo jump into that, Dr. Q, can you explain how, I guess, how no two people with sickle cell are the same?
So, my experience has been that it's unusual to have siblings who both have the same presentation with sickle cell disease. In fact, I can't think of any siblings that I took care of where both of the siblings had the same presentation of their sickle cell disease. And there's a lot of things, genetic modifiers of sickle cell disease that physicians and researchers just don't know about. Nobody really knows why two siblings with the same parents, same genetic mutation have a different presentation. One seems to be sicker than the other one, or has different complications than the other one. And so that it's just part of kind of the mystery of sickle cell disease that it's the same mutation for every single person who has SS, really only SS. There are other types of sickle cell disease, but they're a little more complicated in their genetics. But in SS, it's the same mutation for everybody, but no two people have the same presentation. And the other kind of the thing about being a physician is that means you can't predict you can't tell a parent of a kid who's 3 years old, I can tell you what's going to happen to your child. You can give sort of an overview of these are the things that happen to people who have sickle cell, but you can't narrow down on that one person and say, well, I know what's going to happen to your child, because nobody can tell you that. Um, and I think just one of the things that people have developed recently with all this genetic CRISPR and things, they've been able to realize that there's a gene that controls fetal hemoglobin, and there's many different um, controlling events that happen to control this one gene, and so that in a person you just don't know what all the different um, genetic things that are going on. So it's very difficult to predict or impossible to predict what's going to happen to someone with sickle cell. And I think that's why physicians recommend hydroxyurea and other medications because they want to modify the disease. They know that these medications work, and so they would like every doctor, hopefully, would like to see their patients do as well as possible with the least amount of complications as possible.
So do you want to talk a little bit about your experience? Like, how would you describe your sickle cell in a couple of sentences?
Um, well, I would say my sickle cell, I wouldn't say it's been worse off, but it's been, I would say, in between. Like, I get monthly phoresis. Um, I do hydroxyurea. I do all the iron chelations and all that. And I think as I got older, it's gotten better, I guess I would say. But when I was younger, I was sick every month and I would constantly get pneumonia. And so I think I wouldn't say, because it's hard to compare two siblings, sickle cell, because who are we to say whose is worse and whose is not worse? Because we both have pain in general and we both in the hospital in general. So I would just say I have pain, of course, like everybody else.
Yeah. Um, and Jojo, I like that you said that. Like, I think in the community, we're guilty of this where we say, oh, that pain is not as bad as mine. Like maybe towards people with SC, oh, your pain isn't as bad as SS, or people with beta thalassemia. And I just really don't want us to compare. It's not a pain Olympics. And everybody experiences pain differently. And so it's important to keep that. What might not hurt you might be torture for somebody else and vice versa. So um, I, like you said, Jojo, we all deal with pain. I noticed just between me and my sister, and we have SS, but also we have single gene deletion alpha thalassemia. And so that typically makes the red blood cells a little bit smaller. So we have that same, like if you were to write down on paper all like the nuances of our genotype, it's SS with the single alpha thalassemia deletion. But we both deal with pain, but in different ways. Where Jojo, a lot of your pain and stuff is in your chest. You have a lot of chest and back issues, and mine are joint. And I think you said you might have joint stuff as well, but mine are my hips, my knees, my shoulders, my hands. Those always hurt a lot, and um, yeah, I would say those are probably be the main differences between, the way that sickle cell shows up. I'm not hospitalized too often. I think the last time I was hospitalized was 2017, and that was on my trip to Indonesia. I got really, really sick. Um, and they had to fly me out to Singapore to get care. And that was the last time I've been like admitted into the hospital. Um, and so I guess you can compare it with that. I know Jojo, I don't know when's the last time you've been in the hospital, but
I think I was in the hospital right before Christmas. But before that, it was a while.
It's been a stretch though, right?
It's been, yeah. I think the last time I was in the hospital, after December was when I had Elia.
Okay, so when she had her baby.
Yeah, she's 2. So
So yeah, it's
Maybe,
just it's
yeah.
you meet one person with sickle cell, you meet one person with sickle cell. Doctors shouldn't say, "Oh, you have sickle cell genotype SC." I know exactly how to treat you. You have to treat the person and not, the diagnosis at the end of the day. So I like to give us as an example because like I said, we on paper we're exactly the same, but I've had a hip replacement. Jojo hasn't had a hip replacement. I have retinopathy in my eyes. Jojo hasn't. So there's just different you get to pick I guess your sickle cell chooses,
Your main point.
the prizes for you.
Exactly. Unfortunately, mine's my chest and my back.
Yeah. And then also I have ear problems too. Like I have hearing loss. So I have hearing loss, retinopathy, hips. I got one hip replaced. And then I don't really get crisis. It's just those complications. And then I think Jojo, you get more crisis.
I get more crisis, yes.
Yeah.
So if we look at it, then it sounds like you have it worse. Because your eyes, your ears.
We're not comparing.
We're not comparing. I'm just saying. I'm just saying it sounds like it.
No, but I'm like over here living my life. Yeah.
Yes.
Yeah.
No hospital stays.
Yeah, no hospital. Not too many hospital. A lot of clinic visits though. All right. Hopefully that answers your question. I saw another question come in here, and then after this question, I'd like to do another drawing for the next person to win a sweatshirt. Um, y'all really like talking about this. Oh, you know what? Sorry, I'm going to ask this one. Hi, I have sickle cell SS. I do not suffer from a lot of pain crisis, and I'm not taking any medication. Why is that? I guess that's kind of like a little bit of a nice segue into what we were pretty much discussing.
So I think, like we were just talking about, sickle cell disease affects people much differently. And if you were, the first thing that comes to my mind is some people who have sickle cell disease have very high levels of fetal hemoglobin. And fetal hemoglobin, most people with sickle cell disease have, or many people with sickle cell disease have higher levels of fetal hemoglobin than people without sickle cell disease. So if your fetal hemoglobin is high enough, it does affect your presentation and your complications with sickle cell disease. It interferes with sickling, it increases your hemoglobin, and that makes a difference. There are other things like we were talking about that can affect your complications and how your body deals with sickle cell disease, and some of those are just unknown. Um, but I think it's if you're in that group of people who have hemoglobin SS and don't have a lot of complications, that's really good. And you could have what Cassandra has and Jojo, you could have a alpha gene deletion, and that would affect the way your sickle cell. And that's not something that could be picked up in a routine blood test. There would have to be a specific alpha globin gene screening to figure out whether you were missing an alpha globin gene. There's 4 alpha globin genes, and you could be missing one of them.
All right, we're gonna do a drawing, and then the next question we're gonna do is why are some warriors' eyes yellow and some of them white? Jojo, what is the next way somebody can win? I kind of want to choose someone. Do you mind?
Go ahead. Yeah, go ahead.
I want to choose It's Lynn because if It's Lynn, are you still on? Comment if you're still on. I would like to choose this person because it is their birthday next week. So,
Okay.
and they're 20 years old. Hey. Happy birthday, it's
Watch
Lynn.
the 20 clip.
If you're still on, say something, and we would love to send you one of these handle with hair sweatshirts. Let people know around you. Listen, when my husband, when I'm wearing this shirt and my husband knows I'm wearing it, he doesn't mess with me. He's the nicest. I'm playing. I'm playing. He's nice all the time. But, like he knows to be very, very nice. Yes. So
He massages your feet.
this is my cheat code here. So it's Lynn, if you're still on. Oh, I see you. Congratulations and happy birthday for next week. We will follow up with you on details on sending you one of these. So yeah. All right. So why is it that some of us have yellow eyes and some of us have white eyes?
So that's a very common question, and it has to do with how much hemolysis or how fast your red blood cells break down. So as your red blood cells break down, your liver changes the hemoglobin into bilirubin, and the bilirubin can stain your skin and the white part of your eyes and make them look a little bit yellow. It's kind of disconcerting for people because like most people with sickle cell disease, you can't tell there's no way to know that someone has sickle cell disease. But if the whites of your eyes are yellow, people start wondering, do you have, hepatitis, something wrong with your liver? Why do you have yellow eyes? So it's disconcerting. How can you get rid of that? You have to do something to decrease the hemolysis. And I hate to say the word again, but
No,
hydroxyurea
so
can decrease hemolysis and increase your hemoglobin, which could, over time, it wouldn't happen in a week. It would take a long time, maybe several weeks to a month, but that could affect the hemolysis and the jaundice. Outside of that, there really isn't too much that you can do about that. You could hydrate better, that might work. You could, like we're talking about, you could take better care of yourself just overall, eat vegetables, drink lots of water, get some exercise, and some of that may decrease the jaundice. But it's a common problem and it's very difficult to pin down and treat.
yeah, a lot of people talk about the yellow eyes and then also yellow skin. Like your skin has a yellow undertone, which I feel like my skin has been having kind of a yellow undertone lately. Um, that's all part of the red blood cells breaking down at a faster rate and producing that bilirubin, which is yellow. So it kind of causes those things to look yellow, your eyes and your skin. And so that's one of the only that's one of the few, like, I guess, outward presentations of sickle cell. And so a lot of people hate it. I know, and we're Nigerian. So I know in Nigeria, people don't get hired if they have yellow eyes because they automatically know that you have sickle cell. So I know it is a point of contention for a lot of people out there because, especially in like a place like Nigeria where sickle cell is very, very, very common and pretty much everyone knows something about it. They know to zero you out with your yellow eyes. And so we get a lot of those questions where people do have yellow eyes. And that is that outward thing about sickle cell. Otherwise, sickle cell is pretty much an invisible disease, and a lot of it is, internal. So, there's no magic bullet for getting rid of those yellow eyes, unfortunately. Um, but yeah, that is it's very common within sickle cell.
One thing you do have to think about is jaundice or yellow eyes is also associated with liver disease. So if you do have jaundice, if you have yellow eyes that you haven't had them before, and you've talked to your physician about it, if you develop yellow eyes, you should really talk to your sickle cell physician and maybe be tested to make sure that your liver enzymes are normal, and it is hemolysis rather than actual liver disease.
Jojo, what does mom say every time we have yellow eyes?
She says drink water.
Go and drink your go and drink your water now.
Yes. And then
So,
yellow eyes.
Jojo usually has yellow
Yellow
eyes, and that is the indicator. Go drink your water now, 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 now. Like this very second, go drink your water. So, if y'all want to see the silver lining of yellow eyes, it is something telling you that something going on in your body, and you probably need to do something about it. So,
Right.
that's the silver
Right.
lining. You guys get little hints with sickle cell sometimes where they let you know, like, hey, I'm gonna put this out here for you real quick, and if you don't listen, something worse could happen. So that's one of them. All right. Y'all are on a holistic vibe today, so we are gonna roll with it. A lot of people are saying they don't want to take pharmaceutical medications. A lot of distrust with doctors. That's understandable. Let me just start off and say that's understandable. Most doctors don't know about sickle cell, unfortunately. And we suffer because of that. Um, so, Dr. Q, what do you have to say about the distrust of doctors and people wanting to not take the pharmaceutical route? And we talked a little bit about this, but wanting to take, well, so this question in particular says, I have SS and I don't care for the side effects of these medications. That's real. That's true. Like, understood. I would rather a holistic route. I'm 38, and at this point, I would rather a bone marrow transplant. By the grace of God, I don't get sick. So distrust in doctors, and then this person who doesn't like the side effects of these medications.
So, well, everybody tuning into this, sickle cell is a huge part of your life. And when I was in practice, most of my friends had sickle cell disease, and I took care of Cassandra and her sister, so I know their family very well, and it was like I had a huge family of people who had sickle cell disease. But most doctors, it's a rare disease, so most doctors don't have never seen a person with sickle cell disease. And I think there's some bias because most people who have sickle cell disease are Black, and that actually there's this implicit with white doctors particularly, they just have some kind of weirdness about that. But the major thing is that people just don't know anything about sickle cell disease. The other thing is, if you've heard something about sickle cell disease, you sort of feel like you know a lot about sickle cell disease, but unless you take care of a lot of people with sickle cell disease, your knowledge is limited because as we're talking about here, where two siblings who have sickle cell disease are completely different. You can't have three patients with sickle cell disease and think you know a lot about sickle cell disease. You have to have hundreds of patients with sickle cell disease, and then you start getting this feeling of how it presents, and your knowledge of sickle cell disease becomes more valid. So there are very few doctors who take care of 300 people or four or more with sickle cell disease. So there aren't that many doctors who know a lot about it. And you're going to run in, and especially like you go to the ED, those people are not sickle cell doctors. Those people got trained to take care of accidents, severe infections, emergencies. And so they know very little about sickle cell disease. And unfortunately, a lot of people assume they know something when actually they really don't. And sort of put that on people. Okay, so that's the doctor thing. The pharmaceutical thing, we've had some real shakeups in sickle cell disease treatment. You know, voxelotor was taken off the market just without any really good explanation. Um, Crizolizumab is not approved in the EU. Um, so those things kind of shake your, um, I don't know, your feelings about pharmaceutical companies and whether these drugs, any drug, really works or not, because there's two drugs that didn't didn't work very well, and they were around and their crizolizumab is still around in the United States, but they were they were there, and they were there for years, and lots of people took them, and they seemed to help people. As with I'm talking about voxelotor, and then all of a sudden it's just gone. So and the pharmaceutical company really wasn't particularly straightforward about why they took it off the market for everybody. No more research. People who are on it were just stopped. And I think that through it really sent shock waves through the sickle cell community. And it unfortunately kind of that shock wave, like an earthquake, it went out further and further. And so people are skeptical about pharmaceuticals for, I think, for fairly good reason. If I had sickle cell disease and I was on voxelotor, I'd be a little worried about starting another medication. But things move along, and you have to have a sickle cell physician who understands sickle cell disease and is willing to work with you on therapies. And so hydroxyurea, crizolizumab, other medications that are going to become available probably this year. Um, you have to work with your physician, make sure that this drug seems to be something that would help you, because not all drugs are going to help everybody. They have to be monitored. Um, and you can't, it's not something you can do by yourself. The holistic medicines, the things that are not pharmaceuticals, um, the only issue I have with those is like we said before, is there's not really what you would call evidence that they work. But then, you know, on this other side of the coin is we had evidence that we thought, you know, drugs were going to work, and it turned out they didn't. And I think
Yeah.
that's why you're hearing from Cassandra that hydroxyurea has been around for decades, and so it's really the only drug that physicians who take care of people with sickle cell disease have a long history with, and are familiar with the side effects, and can tell you what's going to happen when you take this drug in a general kind of way. And again, it doesn't work for everybody. So I I really see why there's skepticism for the pharmaceutical industry. And the thing with doctors has been going on since forever. I mean, that's not a new thing. That's been going on for decades and decades, and it's just because sickle cell disease really is a rare disease, and a lot of doctors have never seen a patient with sickle cell disease.
Here in the US or like in Western
Yeah,
countries.
I see something about crisis when people are having menstruation, and that's been shown by studies that that's a real thing, that women during their period do, around that time, have more pain and more problems with their sickle cell disease. So that's a real thing.
You guys, I'm a different person around myself. Like I am a different person. That's how real that is. They already don't study women as much as they study men within medicine. So there's that. And then there's like that and sickle cell. So when I tell you, it's like Dr. Jekyll and Mr. Hyde, when I'm around my cycle, it's like for real, for real. So the hormones are real. The hormones, I think, cause pain. Like they cause me pain in my joints. They cause me pain. Like my hands will start hurting. Like it would be hard to write. Um, and so I'm in a lot more pain around my cycle than, outside of that. So just want to let you know that's real. It's being studied, but, probably not at a rate that, I do feel it is more urgent, but there's a really great organization called Sickle Cell Reproductive Directive, SC Red, and they specialize in sickle cell and reproductive health. And so the founder and executive director, Tiana Wolford, is her organization is kind of leading the charge in reproductive health within sickle cell because it's just understudied within sickle cell. But just know that it is common for, I guess your cycle is a trigger for sickle cell. And, obviously we need more studies, we need more data on that, but that's something that comes up a lot within the community. So you're not alone when it comes to that. Um, I want to ask this question that somebody kept reposting. Thank you for reposting it. It was something about what does HBSS with HPFH mean for my son? And I don't know if that's persistent fetal hemoglobin.
Yeah, that's what it sounds. It sounds like somebody has SS with hereditary persistence of fetal hemoglobin. So hereditary persistence of fetal hemoglobin is like you're taking hydroxyurea, but you don't have to take hydroxyurea. You have a really high level. It can change. So
Okay.
if you have a sickle cell doctor who's curious, and I did this. I don't know if I should have been doing it, but I had a patient whose grandmother really wanted to know what her fetal hemoglobin was because she didn't have symptoms. So every 6 months or so for a while I would check her fetal hemoglobin. But if you have hereditary persistence of fetal hemoglobin, your fetal hemoglobin is extremely high. It's over 20%. And most people who have hereditary persistence of fetal hemoglobin have very few symptoms of sickle cell disease. It doesn't mean that you don't need to see a doctor and you don't have sickle cell disease. It just means that you can expect if that's really what the diagnosis is, and you have to be sure that's what it is, that your son or daughter is going to have a relatively mild course of sickle cell. But sickle cell, you can never trust sickle cell. It's a disease where things happen that you don't expect to happen. I had a patient who had S beta plus thalassemia, sort of the mildest kind of sickle cell disease. And by the time before he was a teenager, he had bilateral AVN. So you just can't, you just have to be on, you can never let your guard down with sickle cell disease. You have to really be paying attention. You can't just say, oh, I have high levels of fetal hemoglobin. I don't need to do anything. Um, you just need to take care of your health, eat well, drink lots of fluids, and hope for the best. But hereditary persistence of fetal hemoglobin is a good thing in sickle cell disease.
Um, yes, I know I actually knew somebody with it and she barely went to the hospital. Like, she just didn't deal with a lot of the symptoms that we deal with. So it is kind of like a boost, right, for having sickle cell. A lot of these new therapies, so hydroxyurea, these gene therapies, all of the goal is to increase fetal hemoglobin. So if we think of fetal hemoglobin like anti-sickling, like their nemesis, sickle cell and fetal hemoglobin. they cancel out each other, right? Our fetal hemoglobin cancels out sickle cell. So that's why a lot of these gene therapies are focused on raising that fetal hemoglobin. So this person in particular was born with high levels of fetal hemoglobin. So that's the goal. They say if your fetal hemoglobin is over a certain point, then sickle cell should be a lot more mild, or maybe you might not even have symptoms. That's what they say. So that's the goal for hydroxyurea, is to increase the fetal hemoglobin. For these gene therapies is to increase that fetal hemoglobin permanently, so you don't have to, take something like hydroxyurea on a day-to-day basis. So that is the goal. If there's anything you should know about kind of like sickle cell and research in sickle cell, know that fetal hemoglobin is extremely important to sickle cell, and it is the approach that a lot of these scientists take in order to um, make sickle cell more manageable, or to quote unquote cure or transform sickle cell. So if you guys are nerds like me, dig into fetal hemoglobin. It's pretty important for kind of just understanding why researchers are doing what they're doing, and then also why it's important for sickle cell. So,
It's
um,
it's also an easy target. Well, nothing's easy in medicine, but it's also an easy target to interfere with the gene that down regulates fetal hemoglobin so that the fetal hemoglobin comes up. And that's easier than to trying to change sickle hemoglobin into normal hemoglobin. So that's why that's a target for a lot of these gene therapies for sickle cell. And there's going to be more coming down the pipeline as well.
okay. I just want to call out this parent. This person said, my son just had his first pain crisis at the age of 2. It was so scary. I couldn't handle it. Just my heart goes out to you, in that I can't even imagine what my mom felt with the two of us here, right? Like, we give my mom a run for her money. Like, there's no such thing as a boring life with sickle cell. No such thing, no such thing. Somebody replied to that comment and said, I had my first, I remember at the age of 2, find a medical trauma therapist for him because I still remember how it felt. So
Oh,
it is,
wow.
it is traumatic. Those pain crises are traumatic. This person said, finding a therapist for that. I believe in that for people with sickle cell, but also caregivers as well. There have been studies that shown PTSD with sickle cell. So don't underrate that. It can put you in some sort of mental state. So definitely, when I mentioned earlier, treating everything about sickle cell, mental health is important in this too. So you guys have to remember to not just treat your physical body, but also, your mind as well, when it comes to that. Any thoughts from either of you in regards to that?
Well, I think most, I'm only surmising this because I don't have any experience, but I think parents who have a child with sickle cell disease, they just seem so normal, and it's hard for you to believe that this little 2-year old or 9-month old or whatever is ever going to be sick because they aren't sick when they're young and they look complete. There's no way to tell there's anything wrong with them. And I think the first time their little baby has a pain episode, it's just overwhelming, because
Yeah.
now you realize be up until that point, you could not, you just sort of couldn't believe that it was really true. But once your child has a pain episode, then you realize this is different and it's really true. My kid has sickle cell disease. Up until that point, I don't think you can really wrap your head around it. So and I think it's not only mental health care for the people who have sickle cell disease, but their providers, their parents, their siblings. It's hard to and their partners after they're
Yeah.
married or have a partner because it's hard to see somebody in that much pain and realize there's nothing you can do about it. You can't do, there's nothing you can do about it. You can give opioids, but that doesn't, it's not, opioids just sort of turns the dial down. It doesn't really take the pain away. So everybody who has, even maybe providers need to have some kind of mental health care. It's hard to take care. The difference between being a provider and being a parent or um, a significant other of someone who has sickle cell disease, as a provider, you think that you can do something. So you don't, you may not be able to do as much as you think you can do, but you think you can do something. So you're not complete, you don't feel that complete sort of helplessness as a provider as you do as a parent. And you don't have the, I think there's also a little bit of guilt that goes along with that. It's hard to be a parent with children who have sickle cell disease, and so Sandra's mom knows that.
I'll say my heart goes out to you. I'm a mom. I can only imagine how hard it is to watch your kid in pain.
Yeah,
But just follow your mother intuition and listen to your son when he's in pain.
yeah, I always feel like it's the hardest part in like, you think about all the people who are in the lives of somebody with sickle cell. There's the provider, there's the parent or guardian, or there's a spouse. I always think caregivers have it harder than actual patients, and this is, me saying this as a patient because it's so hard to watch somebody that you love be in that much pain. Um, my doctor has told me like, most people who go into medicine, they go into medicine wanting to help somebody, right? Wanting to provide care and provide a solution to a problem, right? And with sickle cell, that is so hard to do. And so a lot of doctors can feel discouraged when treating people with sickle cell because they have already such limited tools. Like there's so little amount of therapies there. There's so little research. There's so like sickle cell is in deficit for in every way possible. And so as a doctor, I can imagine it being frustrating to like really have nothing to provide to your patient because that's the way the system has gone for sickle cell, unfortunately. And so everybody involved with sickle cell, including the patient, just everybody involved, they have a hard time. It's hard. I always say sickle cell is a beast. It's tough on all ends. And then also there's doctors, there's so limited amount of sickle cell doctors that they have like an enormous amount of patients as well. And so, a lot of times, I don't know if I told you guys about transition for me, but I was in a really good, you know, um, system, and I had Dr. Q as my sickle cell doctor. But oftentimes, a lot of people go into medicine, specifically within sickle cell, to treat children. And those children have really, really good care. And then when they turn 18, they literally have nobody to go to. There are such limited amount of adult hematologists that this is when people start going to the ER instead of going to clinic to get care for their sickle cell. And we all know the ER is never a good place for anybody with sickle cell because, as Dr. Q said, they don't know too much about sickle cell. Sickle cell is a rare disease here in the US. And so you are battling ignorance, you're battling stigmas, you're battling discriminations, which is why sickle cell is never great to treat in the ER, and which is why we always encourage you to have a sickle cell doc. But now that there's such a small amount of sickle cell docs out there, especially for adults. So I don't think I transitioned from Dr. Q until like I was pregnant with my daughter Zara. And he was like, Okay, it's time for you to transition. Like you're gonna have a baby now. Time for you to transition. And it was so sad. Like luckily I have a great adult sickle cell doctor as well. But I know I recognize, right? I'm next to a comprehensive sickle cell center, and this is the only one on the West Coast of the United States. And so it's really hard for people to find that doc out there. But yes, that's what I'll say to that. I think I just lost my train of thought, guys. Sickle cell brain. Jojo, do you want to do you want to choose somebody for a raffle? For our Valentine's Day raffle?
Sure. Just anybody?
Yeah, just choose someone or do something or say something. This is our sickle cell handle with care shirt, letting everybody around you know to handle you with care. I wear this like if I need to go to the ER, I wear this. And they're like, "Cool, sure." And I was like, "Yeah." And I usually get good care. I don't know if it's the shirt or not, but um, yeah. Go ahead and choose JoJo. Who's next?
I
Who's
would
gonna
go
win
with
this one?
I would go with Paris underscore O dot M dot C dot SELAH.
Okay, let's see here. I don't see that person. If you are that person, could you please comment so I can write down your
Can I ask a question, Dr. Q?
Okay, I don't see that person, Jojo.
No?
We'll give it a few more minutes
Okay.
and we can maybe we'll go ahead and ask the next question. And if not, I'm gonna I see someone that said pick me. It's D Boys 1226. So
Okay.
if Paris is no longer on, we'll give it to D Boys.
Okay.
All right, all right.
I have a question, Dr. Q. Can I ask a question, Kath?
Yeah, of
Yeah,
course.
How come when doctors do the A1C test, or is it the A1C?
yeah.
For
How
diabetes.
come? Yeah, how come they can't? Is it the one? I forget if it's that one, but how come they can't go off of that test for people with sickle cell? Is it the
Uh,
A? I think so.
because it's hemoglobin A1C. So, as you know, if you have sickle cell disease, you don't have normal hemoglobin. So they can't use that test for people with sickle cell disease because the sickle cell hemoglobin interferes with that test.
So what can people do instead of that test to check for diabetes?
Well, the A1C tells you it gives you an overview of what your blood sugar is over a long period of time. The higher it is, like if it's, I don't know, over 5 or 6, if it's 10, that means you're not over that period of time, you're not controlling your hemoglobin or your blood sugar very well. If it's below about 5 or 4.5, then that means your control is very good. Um, and I think without that, I'm not an endocrinologist or a diabetic doctor, but there is probably other studies. You could also just look at what your daily glucose is over time to to make an average of that, but there are probably that I don't know, but there are probably other ways to look at your blood sugar over a long period of time besides hemoglobin A1C.
How do you guys remember your first crisis? How do you do that?
I was gonna ask you if you remember yours.
No, I do not. I barely remember my childhood. I don't hang on to like I don't hang on to that stuff. And I think let's see, somebody said I barely remembered my childhood. Me too. And I think that's due to the pain and hospitalization that I went through as a child. I am exactly the same way. Like I would only remember if I was like actively, trying to jog my memory. But even that, there's one pain crisis that I remember, but I had to be like at least 6 or 7. And I remember it because we were on the road traveling between Des Moines to Iowa City, and that's like an hour and a half, and I was in a pain crisis the whole entire way, and it was just so horrible. Um, so that's one that I remember. And then yeah, I remember all the pain crises I remember are from Iowa when we grew up in Iowa. I just remember like being in fetal position on the floor, like crying, thinking this is like the worst thing ever in my entire life. Um, but I don't have moments like that anymore as an adult. Do you remember your one of your first pain crises?
I remember one. I remember when I was taking a shower and I passed out and dad had to carry me and I was in the ICU. And that's all I remember. That one incident. And I think I was probably like, how would you say, like 5, maybe 5 or
Mhm.
4?
Yeah. Yeah. Um, but you guys remembering your first pain crisis or like your pain crisis when you were young, you guys have a really good memory. Because yeah, I can't remember any of that. But like that person said, like part of the reason why you don't remember your childhood is because of that pain and hospitalization, right? And that's not something you want to think about. So at least for me, so I just push that in the back of my head and keep it pushing, I guess. Um, Somebody said I took my son to the ER for a bug bite and told them about his sickle cell, and it was the worst decision ever made. Yeah, the ER really isn't our friend. Listen, I try to tell this one. I don't know if she's here on your screen. Johanna, her, she likes to go to the ER. She doesn't like going to the ER, but she always goes to the ER. And calling me from the ER. These people are mistreating me, this and that, this and that. I keep telling her, do not go to the ER. Like you go to your day hospital and get, at the very earliest part of all of like, sometimes people get like little hints that they're about to be in a pain crisis. Sometimes people don't. Y'all let me know if you guys do or not. When I get a pain crisis, I get like this pulsing feeling, like every I could just feel all my veins like kind of pulsing in a way. It's weird. Let me know if you guys have that. But the earliest sign, you call your doctor and you tell them, "Hey, I think I'm gonna go into a crisis," and then go into clinic instead of waiting that out and then going to the ER. Because we lose a lot of people in the ER. We do. And for not even any good reason. So stay out of the ER. Y'all help me tell my sister to stay out of the ER. Dr. Everybody, because she doesn't listen. She doesn't listen. Anyway,
Well, one thing you can do with the ER is have call your because sometimes you have pain and it isn't at a very convenient time. You can make a deal with your primary care provider so that you can call them or their service and they can call the emergency room and say, it's where I was, it's called an expect. You can expect this person to come in. They have sickle cell disease. This is what you should do for them. And the other thing is to have a pain plan that you take to the ED with you, signed by your doctor with their information, so that the person in the ED at least knows how to treat your pain and knows how to call your doctor if there's a problem. So if they run up against something and they're having an issue with it, they know who to call to ask about what's going on with you. There's at least your service if you're not on call. So that's really important. Just walking into the ED with a bug bite and saying, "Oh, I have sickle cell." Boy, that's just like that's that just rings everybody's bells. I can only imagine what that parent went through.
You guys, I'm just getting to your comments about the sweatshirt. No, I don't have it on sale. I don't. You have to win it here. Maybe somebody from the team can set that up for us. But yes, this is, and I went ahead and I put down Du Bois 1226 as a winner. For the sweatshirt. We'll probably give one more away. So and then we'll probably close out in a couple minutes here. Um I will try and make it more available, or maybe we can do some sort of campaign or fundraiser where we're fundraising some of these sweatshirts, and so we can make it a little bit more accessible. But as of right now, I don't have anything set up for that. Sorry, I'm catching up on your comments. I remember the serious crisis, the other ones not so much. Barely remember anything from childhood. Same here. Same here. Oh, we have a patient from Saudi Arabia. Hello. Hello, hello. I went to Saudi Arabia is on my list. I got to go to UAE and I got to go to Oman last year. Um, if you guys want to travel to the Middle East, if you like traveling, they know about sickle cell in the Middle East. They do. So they can treatment and everything. What I would be concerned about is the plane ride. But if you get there and you get sick, they definitely know how to treat people with sickle cell. Um, Somebody said I didn't have many pain crises as a child. My mom told me I had pneumonia more often. That's true. Me too. And I was always in the ICU between the ages of 3 and 4. That sounds about right for us too, I would say, right, Jojo? Jojo, she's the type to pass out from a pain crisis. And I said somebody says here, I think I was 4 when I passed out and my parents rushed me to the hospital. I wish I could pass out when I was in the pain crisis. I do. Huh? I can't hear you. Oh, why? Well, what is it like? I don't know what it's like to pass. I think maybe only when I'm in the hospital I will like go in and out of consciousness, but like before the hospital, you pass out. And I just wish somebody would knock me out when I'm in that type of pain because I don't want to deal with it. I don't know if it's the same thing or not. Jojo, what is it like to pass out with sickle cell or pass out in crisis?
You want to pass out?
No? But do you still like, are you still like feeling the pain and everything?
Do it afterwards.
But you're like not there for some of it, right?
For like 5 seconds, a minute or two.
Oh, okay. Okay. Okay, maybe not then. The way I think about passing out is like getting knocked out because when I get in that pain, I just really want to try and sleep so that I don't have to deal with it. Like, just find any way so you don't have to deal with it. And so that's kind of what I was thinking about. But yeah. Okay. Gosh, you guys remember your first hospitalization at 2 and 1? How? Your brain needs to be studied. I mean, maybe it doesn't, but I think you should get some sort of designation for having a really good memory. Okay. So somebody asked, I like this question. Somebody asked about seeing a specialist regarding having a crisis during menstruation. And Somebody also asked what cities have clinics because I haven't seen or heard of any where I live. So you can think there are some centers that specialize in treating sickle cell. Now, there's not a lot of them, and that's the problem here. I believe UCSF is the only center within the West Coast. They have centers in Atlanta. They have centers, I think in Maryland, John Hopkins and St. Jude's, I think, has a sickle cell center. But, there's probably only a handful of like comprehensive sickle cell center. And I say comprehensive sickle cell center because here at UCSF, I told them about like my period, my cycle, and it triggering sickle cell, and they had like a specialist where it was like a woman's health specialist that knew about sickle cell. And it's only that combination is rare. You only find those type of people in centers and not like in the middle of nowhere where there's a ER down the street. You won't find those type of people. So any kind of specialist, they're usually associated with a center where they do research and they have a sickle cell clinic and so on and so forth. What do you say to that, Dr. Q?
Well, in California, actually, we have a center in Sacramento, UCSF in Sacramento and Oakland, and there's a smaller center in San Francisco. UCLA has a couple of centers. You basically need a population of people who have sickle cell disease to have a sickle cell center. You can't have a sickle cell center in Kansas because
Yeah.
there's not enough people with sickle cell disease. So most of the sickle cell centers are in the South, and then up around New York, up in that area. And there used to be 10 sickle back in the day. There used to be 10 sickle cell centers that were federally funded in the United States, and those centers they were primarily pediatric centers, but they um, still exist on some level across the country. And then there are other centers who have kind of taken up the slack. But you can go to the Sickle Cell Association of America, and you can look on their website, and they will have a list of all the sickle cell uh, centers in your area if you look on the list. But you may be in a state where there aren't any. That would be pretty common. They're usually on the East Coast, in the South, some up around, Washington, Virginia, maybe up in Boston area, but that's it.
Somebody said wondering, okay, it's Lynn, wondering what will happen because I have won a shirt and live so far away. I would really appreciate it. Okay. Um, if do you live in the US? It's Lynn. If you live in the US, it won't be a problem. It might be harder if you're outside the US, but we'll make it work. Um, yes, NYC has a few, I believe. Yes, you're right. So if you're looking at the United States, it's New York, Georgia, Florida, Texas, and California. Those states have the most individuals living with sickle cell. So you're more than likely to find sickle cell centers there. Now, if you grew up in Iowa like me, um, they could, right? And I lived in the city. So I lived in Des Moines. I lived in the capital of Iowa. And to be fair, I did have sickle cell care there. I think my mom was really intentional about that. So, always living next to a place that had some sort of research and some sort of clinic that specializes in sickle cell. So when we moved from Des Moines, Iowa to here, the Bay Area, part of the reason why we moved here was because they had really good sickle cell care. So she kind of thought about that. And so I've always had access to care. However, if you're living in Dubuque, Iowa, or, somewhere like that's just, there's not a lot of you find sickle cell where you find Black people. And so if you're not in an area that has like Dr. Q said, a high prevalence of sickle cell, you're probably not going to find a sickle cell center. You probably have to do a lot of traveling or um, find someone around you that is willing to treat your sickle cell, and it's not impossible. So, yeah. Do they have centers in Minneapolis? There is
I think there
an
is. I
organization called Sickle Cell Minnesota, and I believe they worked Ray Blaylark, and I think she's on social media too. And Sickle Cell MN is on social media, and she works with some sort of center or some sort of, place where they have sickle cell. Did you say you know of a place in Minneapolis?
I don't offhand. I think they do have a center though.
Okay. And then Florida, you asked about Florida. What do you guys know of a sickle cell center? Um, in Fort Lauderdale, there is Foundation of Sickle Cell, uh, um, Foundation of Sickle Cell Research, I think, and they have a center for sickle cell there. I do think there are centers kind of spread throughout, and then there's like the best way to find out is to find your local advocacy group or your local organization, and there are a lot in Florida. I believe there's one in I think they're more in South Florida. I believe there's one in Tampa. I think it's called ASAP Informed, and don't you have to look into this because I'm not sure if I'm completely 100% right. And then there's, FSCDR, the Foundation for Sickle Cell Research. And there's a couple other groups down in Florida too. So, and they would be the best to tell you where to go and where not to go, what doctor to see, what doctor not to see, because they have people coming to them telling them like, hey, this doctor is horrible. And so link up with your local sickle cell organization, and they would have even more information than what we're able to provide you here. Um, the last thing, the last question I'll ask you, do you want to choose the last question?
I don't see any on this side.
Okay, I like this question. Are there different types of crisis? That's a good question. I love that.
Yeah, crisis is kind of a word that covers everything, which is annoying to me personally because they call everything a crisis. So there's pain crisis, acute chest syndrome crisis, bone crisis, but so crisis just means some kind of sickle cell related event that is causes bodily injury or pain. Um, it's much better to talk about what we were just talking about, avascular necrosis of the hip, acute chest syndrome, um, pain events that and where they are, rather than calling everything a crisis, because it just
Yeah.
isn't, it's so non-specific. What a cute little girl you've got there.
Mhm.
Or boy, I
Thank
can't
you.
tell. Look at
Girl, her name is Elia.
that.
Hi, Ellie
Anyway,
Boo.
crisis is just not a very good word to use when you're talking about sickle cell disease. You should focus in on whether it's a pain crisis, where it is. Is jaundice a sickle cell crisis? Well, you don't know unless you know that your liver functions okay, or your hemoglobin isn't really, really super low. So that's my take on the word crisis in sickle cell. But a lot of studies and a lot of people talk about sickle cell crisis, which doesn't really explain the situation.
Yeah. Um, so yeah, there are definitely different types of crisis. Acute chest syndrome is one of them. Um, I didn't
Well,
hear too much about aplastic crisis.
no,
Is
no,
that
it's a
is that
really
the
a
parvo
parvovirus.
virus?
Yeah.
Um,
Well, there's, in kids, there's splenic sequestration, parvovirus
no.
infections. You could, is retinopathy a crisis? I don't know.
So yeah, it's just
Yeah.
kind of one of those ambiguous words,
Yeah.
crisis, unfortunately. And um, I think there should be different, lexicon because then like, if your knee is hurting, that's way different than you having like, sickling within your chest, which could cause like there's levels to this
Right.
and they shouldn't all just be called crisis. So yeah, something to think about. All right, so I'm going to give this last sweatshirt to I just saw the name Butterfly Unleashed. Um, would love to give you one of these or I'd love to send you one of these. If you're still on, comment below. Handle with care is letting them know to treat us nice, treat us kind, be respectful, treat us with love and respect. So this this comes in clutch. I sleep in it. If I'm cold, I'll put it on. So Butterfly Unleashed, I'd love to give you one of these. And we are going to wrap up our special Valentine's Day session. Thank you guys for being with us on Valentine's
Yeah,
Day.
thank
Like
you.
I know y'all got stuff to do. Like I know you guys are doing cute things on Valentine's Day. So thank you so much for being with us. I would love to give out more of these. Unfortunately, I don't have an unlimited budget, but I can definitely promise that we'll do a lot more of these giveaways in the future. Ask Dr. Q. So if you didn't get one today, log in. Next time we'll be back in, is it 2 weeks or we'll be back next week, I think.
Yeah.
Um, so we'll give these out periodically and then I'll try and start up a fundraiser for some of these if you guys just want to buy. Um, so thank you so much for being here. Happy Valentine's Day. I'll give it over to Dr. Q to say his special statement.
Okay, so I'm a pediatrician, not a hematologist. I took care of people with sickle cell disease for a couple of decades or so. And my opinion, what you hear on this from me and sickle cell 101 is just for information only. We're not trying to treat people. We're not trying to tell you what kind of treatment to have. Those kinds of things are for you and your sickle cell disease provider. Sickle Cell 101 and myself, we just try to provide information and our opinion. And other physicians may not agree with what I've told you or said about sickle cell disease on this program. So you can take that with a grain of salt. So we just try to give you the information as we know it. So that's my disclaimer.
What are you guys doing for Valentine's Day? You guys doing anything special? This was the big thing for me, like wearing my sickle cell shirt and putting on red lipstick. That was like the main attraction for Valentine's Day for me. What are you doing, JoJo? Anything?
My main, I think I was making the kids' Valentine's basket. That was it. That was my main
Okay.
thing.
Dr. Q, are you doing anything special for Valentine's Day?
Well, my wife is working, so I think I'll have to, and I'm retired, she's not. So I think I'll have to run out right after this and get some flowers and candy.
You haven't already gotten that?
I
No,
take care of my
I'm playing.
job is to take care of my two grandchildren 7 days a week. So I'm taking care of two little kids who are driving me
Oh my God.
bonkers every day. And I don't have time to do
No,
anything
no, I'm
except make
playing.
sure they don't beat each other up or get into
That's
trouble.
that's real. That's real. Out to eat
They're great
somewhere.
kids. They're great kids, though. They're really sweet. I have a good time taking care of them.
Well, I hope you guys know I love you all so much, my
Yeah.
sickle
Yeah.
siblings, and happy sending our love, especially today on Valentine's Day. Even if you're not doing anything, just know that you're loved, you're appreciated. Thank you guys so much for being here. And yeah, we will see you in a little bit. I don't know if you want to say anything. That was my sister JoJo there, my little sister Johanna. Thank you guys for being nice to her. Thank you, Jojo, for showing Ellie. Thank you guys so much, and happy Friday too. Enjoy the weekend.
And if you have other questions, ask Sickle Cell 101 and I'll answer them for you.
Yes, send your questions to ask@sc101.org if you didn't get it answered, and we'll be back next week. All right.
Bye-bye, everybody.
See you later.
Happy Valentine's Day.
Happy Valentine's Day. Bye.
Bye.